Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update. And I'm joined today by Dr. Lawrence Lowe, our Medical Officer of Health for Peel Region, and Paul Morrison, our Commissioner of Legislative Services and the Director of Bylaw Enforcement. I want to start by recognizing this is 1 year since the city declared a state of emergency for the COVID-19 pandemic, and in that last year I've seen incredible generosity. I've seen the community stand up together to help the less fortunate. I also want to acknowledge we faced real hardship over the last year. Brampton and Peel Region have been hit particularly hard, not because of the actions of any individuals, but because of the nature of the work environment. And I just want to acknowledge that in that adversity we've seen some a beautiful sense of community where people have really stepped up. And I know that there are better days ahead. The second thing I want to reference today is the provincial budget. Obviously, this is the most important document of the year, and it's critical for Brampton. We've been waging a campaign for a long time, our Fair Share, Fair Brampton campaign, focused on the need for a new hospital. The provincial average for hospital beds is 2.16 beds for 1,000 residents. And in Brampton, we only have 0.96. We have less than half the hospital beds that is the provincial average. And so when people talk about our hospitals being at capacity during COVID, we were at capacity before COVID even started. And so it really highlights the challenge we've faced. Where other communities had the capacity to handle COVID patients, we were really stretched at the very beginning, before the very first COVID patient. And so it really speaks to the importance of this request for a new hospital that we hope will be considered in today's provincial budget. And I should also highlight, we've been asking the province for additional opportunities for post-secondary education. We are the only big city in Canada without a university, and if you look at some of the shortages we have, and you look at health human resources being an example, this is something that is important as well. So I'm cautiously optimistic for today's provincial budget, and I look forward to watching that. As Peter Bethlenfalvey gives his first budget at 4 p.m. Today, it will be a critical budget for Brampton. We really need the provincial government to come through. In terms of a bylaw update, there's been 21 charges between March 15th and March 21st. 6 charges were under the mandatory face covering bylaw, 15 charges under the Reopening of Ontario Act. I would note we do try to educate first before bylaw lays charges, and so we're trying to have a collaborative and cooperative approach with the public, and by and large the public is listening. There's always a few bad apples, but by and large we continue to see wide participation of the public understanding the challenges associated with the public health emergency. In terms of the situation at William Osler, we have 47 COVID-19 inpatients at Brampton Civic, including 2 people in ICU. So I would say the hospital numbers are starting to creep up. A month ago, we started to see lower numbers at the hospital, and so obviously this potential third wave we're starting to see in the hospital. We have an additional 17 COVID-19 suspect patients awaiting test results at Brampton Civic. And to date, the hospital has conducted 379,279 COVID-19 tests, so they continue with a very aggressive pace of testing. And another issue that I wanted to touch on in my update today is vaccines. I spoke with frustration and anger on the weekend that Peel was left out of the pharmacy pilot project. And I want to thank the provincial government for rectifying that error so quickly. And as I said on the weekend, we have 20% of the COVID cases in Ontario. We have 10% of the population. We had 9% of the vaccines. I can't reconcile those numbers, and I appreciate that our local minister, Prabmeet Sarkaria, and Sylvia Jones jumped on the issue right away for us. We spoke to the Premier, and he was very supportive of fixing this. And so when a government fixes a mistake quickly, I just want to thank them for that reasonableness. The next thing I want to mention on vaccines is I want to commend Dr. Lowe and his team at Peel Public Health on a new milestone in the vaccine rollout, with now more than 100,000 vaccines administered to eligible residents across the region. And I will now invite Dr. Lowe up to the podium to say a few words.
Thank you, Mr. Mayor, and thank you for your kind words. Good morning. This week, Brampton's Brampton's weekly incidence rate is at 173.3 cases per 100,000, which is up from 145.6 cases per 100,000 last week, and the community's reproductive number stands at 1.12. While spring has sprung, our trends have increased for the second week in a row. This means we are seeing the start of a third wave resurgence in the region of Peel and in the city of Brampton, and frankly, probably just a resurgence of the second wave because we never actually exited. As I've said previously, however, changes in the weather, vaccine coverage, and variants of concern make it difficult to know exactly how severe this resurgence will be. However, as Mayor Brown has mentioned, our community has hit an exciting milestone in our ongoing pandemic response, surpassing 100,000 vaccines administered in the region of Peel just earlier this week. We have a long way to go, but this is exciting news, and we're also excited that residents over the age of 75 are now eligible for vaccine in our community. And with all 10 of our mass vaccination clinics throughout the community and operated with our hospital partners now up and running, with the 11th at Chris Gibson slated to open early in April, we are now offering thousands of appointments a week to eligible residents, which will provide more eligible residents an opportunity to access this protection with greater convenience throughout our community. In Brampton, we have sites operational at the Region of Peel's headquarters at 10 Peel Centre Drive and at the Save Max Soccer Centre, and residents in Brampton East can also access the International Centre nearby in Malton. Appointments are available on the provincial booking system at covid-19.ontario.ca/book-vaccine. For those without internet access, the Region of Peel is pleased to offer booking assistance for those who cannot book online at 905-791-5202 from 8 a.m. to 8 p.m. 7 days a week. Again, that's 905-791-5202. So I urge all of our residents who are eligible, please book an appointment. And if you know someone who needs a little help and is over 75, getting to the appointment or helping them to book an appointment, please reach out to them. Getting our community vaccinated is the best way to protect each of us and our loved ones against COVID-19, and it will do all of us taking our part to reach community immunity and start to drive numbers down so that we can exit this pandemic response permanently. Ultimately, the response continues to be in our hands, and we can get through this while saving lives and mitigating potential impact to our hospitals. There's no secret on the other things that we also need to do. We still need support for our essential workers. The more contagious variants can spread more quickly in essential workplaces if precautions aren't adhered to. So it's even more critical for us to have inspections, investigations, and protections such as paid sick days. On that note, the continued absence of sick leave means that our essential workers are unable to get isolated, get tested without forgoing their salary, and increasingly, they're also unable to take time off to get vaccinated, and that does not bode well for our ultimate success. Overall, though, the rest of our game plan still remains simple. Limit contact with those you do not live with, and if you must meet, ensure that you stick to the precautions of masking and distancing. Choose the outdoors over the indoors as much as possible, and remember that outdoors is low risk, not no risk, which requires you to still stick to the precautions to keep safe. Get tested and self-isolate if you're sick, get the shot if it's your turn, and if you know someone 75 or older in our community who needs some help to get out to the vaccine, help them out, help them book, help them get there. Looking out for each other is ultimately how we're going to get to the other side of this. I thank you all, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, and now we're happy to take some questions. First up, Courtney Hills from CP24.
Hi, my question is for Dr. Lowe. I just wanted to follow up on where talks stand over the possibility of returning to remote learning for students in Peel Region. I know there were some conversations last week. Those talks continued yesterday. So I guess my question is, what's your recommendation and what is backing up that recommendation at this point?
Thanks so much, Courtney, for the question. We obviously remain in very close contact with our school board partners, the Ministry of Education and the Ministry of Health, around in-person learning versus other modalities. We know that in-person learning has tremendous benefits for our children, for their socialization and development, in addition to their education. At this time, only 3 of the school closures in our region are due to transmission that was observed, and that's out of almost 550 schools throughout the region of Peel. We do know that other schools have closed for operational reasons. This is because in order to prevent onwards transmission, one of the things that is done is an automatic dismissal of impacted and exposed individuals. So it's not a reflection of the safety of the school setting, but in fact the safety measure that is taken, similar to closing a workplace or closing a community at a large scale. So to the extent that the measures are in place, continuing to protect students, and that we only have 3 that are due to an outbreak, 3 closures that are due to an outbreak out of 550 schools, there is no decision or recommendation at this time to move to another mode of learning. Thanks for the question.
Thank you, Dr. Lowe. My next question is for Mayor Brown. You talked about the need for a new hospital in your community. I'm sure you've seen reports suggesting that Brampton will be getting a new hospital that is expected to be announced in the provincial budget this afternoon. Are you able to confirm this then?
I can't comment on it until 4 p.m. I would just say this was the biggest ask of the city of Brampton. We've led a Fair Share campaign, which is the largest petition in Brampton history, and I have high hopes for good news at 4 p.m. Next question is Sabrina, the Mississauga News.
Hi there. So my question is for Dr. Lowe. So, Dr. Lowe, I wanted to see if there was any updates on the Brampton Amazon facility and the investigation. I believe the limit for Amazon to appeal the closure of the facility ends on Saturday, so just wanted to see if any updates there.
Yeah, thanks very much for the question, Sabrina. Obviously, there have been no new cases detected in the workplace because the workplace is closed and it has been compliant. Amazon has been compliant. We have continued our conversations with Amazon and continuing to ensure that that facility is able to make changes to continue to keep that workforce and our community safe when they do reopen. And at this point in time, we have not been notified of any appeal that has been filed with the Health Services and Review Board. Thank you for the question.
Thanks. So just to follow up, so we're seeing in numbers increase again for the second week in a row. What happens if these numbers continue to increase and we sort of get back into a dangerous zone? What would your recommendations be?
Well, Sabrina, we're taking it day by day. As I mentioned, there's a lot of trends that are sort of overlapping. We do know with the warmer weather, people will spend time outside, and that will hopefully diminish risk of transmission. We are continuing to administer vaccine in greater and greater numbers. As I mentioned, thousands of appointments a day at many sites throughout our systems and with our hospital partners, continuing to get that protection out to the community. And certainly, as I mentioned, keeping an eye on the numbers, we do know that with the variants and the outbreaks we're seeing, there is increasing transmission, increasing numbers, et cetera. It's absolutely vital that people continue to stick to the precautions, continue to take care and stick to the precautions until they can access the protection of a vaccine, because we are also starting to see more severity associated with the variants of concern. But to the extent that people can prefer the outdoors and take the vaccine when their turn comes and stick to the precautions, hopefully we'll all get through this safe, and the next couple of months we'll see a resolution. Thanks very much.
Thank you, Dr. Lowe. Our next question is Steve from in Brampton.
Good morning. This is for the mayor.
Yes.
And the question is, how do you see the supply of vaccine flowing into Brampton? We're seeing a lot of reports with people saying that a lot of the vaccination centers are largely empty for the most part. Are you optimistic that the supply is going to keep on coming to support all these centers?
No, I'm disappointed, obviously, I think, like many Canadians, about the vaccine supply. I think Canada's, the latest I heard was 54th on the list of countries in the world for vaccine supply per capita. Of course, I'd like to see Canada do better. We have the capacity locally that we could, in Peel Region, be doing, if you ramped up all efforts, you could be doing 70,000 plus vaccines a day. And, I think the other day I heard there was 1,250 vaccines in Brampton, 1,250 in Mississauga, we're doing a pittance of what we could be doing. We have the centers ready. We've got the staff ready. We've got the mechanism set up to vaccinate the public very quickly. And, kudos to Dr. Lowe, Naveed and Michelle at Trillium. They've built some great systems to vaccinate the public. The only thing we're missing is supply. So they're doing the best they can with the supply we're being given. But any notion that it's enough or adequate or I'd be happy with it is certainly a stretch.
That's all.
Okay, thank you,
Thank
Steve.
you.
Nikki Cedrone from the Bramptonist. Nikki? Okay, we'll go to the next question. Oh, you there?
Good morning.
Morning.
I'm here. This question is for Mayor Brown. You have been an advocate for reopening outdoor activities, which I think is welcome news to everyone who is tired of being locked up. I think in addition to reopening outdoor activities, it's becoming more important to balance the need to keep people safe against the need to get Brampton back to business. Brampton businesses like hair salons are increasingly frustrated at having to stay closed despite implementing contact tracing, while malls and large stores operate with no contact tracing at all. With the province allowing regions to move back into the color zones, we see the return of region hopping. The result has been an exodus of Bramptonians to going to open regions to obtain services, while Brampton businesses face closure and bankruptcy. When do you see Bramptonians able to stop region hopping so that they can shop locally and put money back into the community?
Okay, well, Nikki, that's a very fair question. A few comments here. One, I have said for a long time that it doesn't work having the GTA split up. We're too interconnected. Now, Dr. Lowe's only responsible for Peel region, so he can't comment on other regions. But what I can say as mayor of Brampton is I think the notion that people from one municipality in the GTA won't visit open areas in other parts of the GTA is naive. We know from the cell phone data that we have access to that people in Scarborough are going to Markham, people in Mississauga are going to the open areas in Oakville and Halton, people in Brampton are going to open areas in Vaughan. We're too interconnected, and I think that's one of the real challenges with the current lockdown provisions in the GTA is that they're not consistent, and that is a problem. In terms of outdoor activities, there's been advocacy from Peel Region and the City of Toronto to open up outdoor activities. I know that's something that's been submitted to the Provincial Health Table, and I hope that the province will support that request. I believe it has support from public health, and I do think outdoor activities are good for community health. I worry that during this pandemic that we're going to see rising rates of obesity, mental health challenges, to give people outdoor activities they can participate in. I know there's a few that are allowed right now, but if we could lift those restrictions and allow outdoor activities from cricket to baseball to the whole variety of to gyms functioning outdoors, to dance outdoors. I think we've got some incredible sporting organizations that would jump at the opportunity to be able to be active again. It's something that I support. Lastly, in terms of hair salons, if I can be perfectly honest, when I wake up in the morning, I feel like I'm a porcupine now because my hair sticks right up. And I think there's only so long that you can expect people to go without personal care services. We've been shut down in Peel Region since November 23rd. I understand there's conversations right now at the Provincial Health Table of what type of provisions could be made to have some amendments here, whether it's open windows, increased ventilation, and I would really hope that there's some solution found, because I really believe that what's happened is initially you had the public goodwill where they weren't going to personal care services. I think what I've seen is that people are now going to get their hair cut in a manner that's not as safe. I keep on hearing about an underground economy where people are getting their hair cut in basements, and that these businesses, so they don't go bankrupt, are finding ways inconsistent with the public health guidelines to continue to bring some revenue in. And I don't think that's helpful for anyone. And On top of that, you have people going to open areas to get their hair cut, which are going to further bankrupt the companies here. And so I would only say this. There are active conversations happening about how there could be some adjustments to the gray zone that would allow some personal care services in a safe manner, and I really encourage those conversations. I do think this needs to be looked at. I'm not sure if Dr. Lowe wants to add anything to the question.
Thank you so much for the question, Nikki, and thank you, Mayor Brown. Certainly, I can confirm what Mayor Brown has said, that all of these, in terms of outdoor activities as well as personal care services, are points of active discussion. But just going back to the remarks that I made this morning, it is clear that we are seeing a resurgence at this time. Certainly it does call for caution, but to the extent that we recognize as well that there is a need to balance with, the ongoing challenges that are faced by our proprietors and our small businesses, and certainly recognizing in recognition of the sacrifices that they have made to save lives, to really ensure that this pandemic didn't intensify in the way that it was modeled and anticipated in our community by changing the way we came in contact, by changing the way we came in interactions. I think that's certainly something that's also in the back of our mind. And also I would share with Mayor Brown's piece, my team is starting to look at the region hopping question, and there is initial data that we're examining that suggests that some of the reason why we're still seeing cases in the region of Peel is related to people accessing and acquiring COVID-19 in other jurisdictions. So, we're, to the extent that we are trying to dive deeper into that, it really does speak to the need for us to look at the interconnectedness of the GTA and how some regions may choose to take a different approach, but that actually has impacts on other regions. Thank you very much.
Okay, Nikki,
Thank you very much.
Is there a follow-up?
Nope,
Okay,
thank you.
Thank you. We have time for one more question, and we'll go to Nitin Chopra from Prime Asia TV.
Thank you. Thank you. Good morning to all. My question to Mayor Brown, as you said that shortage of vaccine is there here in the Peel region, we have Team Brampton, including the Member of Parliament. Mayor, did you talk to the MPs because they represent federal so that they can take up this issue? This is important because if vaccination centers are empty and we don't have a supply, then all the hard work goes down the drain.
So we do have active conversations with our MPPs, our MPs. I think it's helpful that everyone is working in the same direction. I would say this: the issue from a federal level is not that Peel region's being left out. They give an equal amount of vaccines per capita around the country. The issue is just the general shortage of vaccines. So Ontario doesn't get enough vaccines. Canada doesn't have enough vaccines. That's the issue. And so we need to get more procurement of vaccines. And that's the biggest challenge. We would be off to the races if we had supply. We've got the capacity that we could be doing, maybe 35 times more than what we're doing right now. And that's just a rough estimate, but the capacity is there, the space is there. We just need supply, and I hope that Prime Minister Trudeau and Anita Anand, the minister in charge of this file, will be aggressive in looking for additional procurement opportunities to get vaccines in a timely fashion to Canada. Is there a follow-up question, Nita?
Yes, follow-up for Bylaw Director, Paul Morrison. Paul, do you have any, we have an issue of lodging houses here in Brampton. So do you have any figure how many complaints we get and what action city took in the past or the recent or in the future to tackle this issue of housing lodging? What is the update into that? Thank you.
Thank you, Nitin. It's a good question. We still continue to get lodging house complaints. I can't tell you how many off the top of my head, but we do get some. I think a lot of this is attributed to the fact that we're asking people to stay home, so people see more residents in the homes or more visitors in the homes sometimes. So we do visit those as best we can. Where there's an issue of safety, we'll go in and we'll address the lodging house. But for the most part, we try to gain cooperation by conversing with the owners, with the tenants, et cetera, to make sure that they're following all the conditions of the city. Once the pandemic's lifted, the emergency order in the city, we will be going back into lodging houses in more formal fashion and addressing the complaints that the people are putting forward from the city.
Well, thank you, Paul, and the dedication of the bylaw officers. They've had a lot put on their shoulders during this pandemic, and we've got an incredible team at the Brampton Bylaw Department that are trying to work cooperatively with the public while at the same time making sure the aims of public health are achieved. So on that note, thank you for tuning in once again for our weekly COVID-19 update. And until next week, stay safe and remember to listen to the advice of Peel Public Health.